We will now move to agenda item 5D, Action Plan for the Health Sector Response to HIV in the WHO European Region. The relevant document is EUR/RC66/9. The resolution can be found in document EUR/RC66, Conference Doc 5, Revision 2, and the financial implications are given in document EUR/RC66/9, Addendum 1. While new HIV infections are decreasing globally, the European region is the only region where new HIV infections are on the rise. Ladies and gentlemen, today we have to address one of the most pressing challenges in our region. The Action Plan for the Health Sector Response to HIV in the Euro region advocates for an urgent and accelerated people-centered health system response to HIV. In this session, we will consider the Action Plan, its vision, goals and targets, and call for the adoption of a resolution. Before I give the floor to Dr. Nedret Emiroglu, Director of the Division of Health Emergencies and Communicable Diseases, to introduce the topic. Dr. Emiroglu, you have the floor.
Thank you very much, President, Madam Director General, Regional Director. I have the honor of presenting you the new action plan on HIV in Europe for your consideration. As the Regional Director mentioned in her opening speech, current pace of action is insufficient to stop and reverse the HIV epidemic in the region. And we are in a turning point in HIV epidemic, which calls for commitment for an urgent and accelerated response to HIV. Let me tell you why. We are at a critical point because, as the President ensured, while new infections are decreasing, which is the blue line globally, since 2005, it has been increasing in the region, which is the green line, by 76%. It is more than doubling in the eastern part of the region, which is translated into 142 new HIV infections during the last year. And again, the majority is being reported or detected in the eastern part of the region. Not only are the new infections increasing, but also the epidemic remains concentrated in the key populations who get less attention, mainly among men who have sex with men, mostly in the western part, and people who inject drugs, mostly in the eastern part, and of course other key populations like the sex workers. This is partially due to late diagnosis or no diagnosis. In the region, we estimate that up to half of people living with HIV are unaware of their situation, and about half who are infected are diagnosed at a late stage, meaning that we do not detect enough cases or early enough, which leads to delay initiation and low treatment coverage, which is leading to low viral suppression. That's like 1% of people living with HIV in the East were receiving treatment in 2015 only, as the green line shows, and AIDS diagnoses continue to increase and the treatment gap widens, which is shown as the blue bars, where we see an increase in the region up to 1 million people receiving the treatment. But as I mentioned, either they receive it late or there's a huge treatment gap causing the epidemic to grow further. But one good news, we are very honored, is to see that 3 of our countries receiving the elimination of mother-to-child transmission of HIV and or syphilis, Armenia, Belarus, and Moldova. They were awarded with the elimination certificates at the high-level meeting on HIV in New York in June this year. And I know that we're working together with many other member states who would like to validate this status, which we are looking forward to work together more and provide the support. This is why we have prepared the new action plan in broad consultation with you, and thanks very much for your interest. And it calls for an urgent and accelerated fast-track health sector response to HIV that builds on the lessons learned from the previous action plan, which expired in 2015. And the goals and targets, even though they're ambitious, are aligned with the other global commitments, the Sustainable Development Goals, the UNAIDS multi-sectoral strategy, Health 2020 in the European region, the WHO Global Health Sector Strategy for HIV, as well as the UN high-level meeting outcome in June this year. And it suggests significant reformulation, innovation and accelerated action, and implementation of all evidence-based, high-impact interventions. So let me just go through the main elements of the action plan. It's built on 3 frameworks as the global one: universal health coverage, continuum of HIV services, and the promotion of public health approach. Our vision is by 2030, 0 new HIV infections, 0 HIV-related deaths, and 0 HIV-related discrimination. And the goal is of course, by 2030 to end the AIDS epidemic as a public health threat in the European region in the context of assuring healthy lives and promoting well-being. I'm not getting into details, but the key targets are as in the UNAIDS strategy 90-90-90, which is 90% people living with HIV know their status. 90% of people diagnosed with HIV receive ART, the treatment, and 90% people living with HIV on the treatment achieve viral suppression. And it also takes into account the unique situation of the countries, offering country-tailored intervention packages, looking into the epidemiology, political, social, economic context of the countries. And the action plan is formulated around 5 strategic directions, and I will provide you some highlights on the priorities from those. The first one is around the information and calls for a set of fast-track action for member states, WHO and partners on the need to generate data and use the quality strategic information about HIV epidemics. So it forms the basis for the focused national strategic planning and program implementation, as well as the advocacy to raise the political commitment. And it also guides member states to monitor the performance of their program and adjust their interventions. Strategic 2 is describing the critical, high-impact, evidence-based interventions to optimize the continuum of care, which includes the full cycle from prevention, testing, treatment, and care. And it also prioritizes the key and vulnerable populations. And it encourages countries to define an essential set of package of interventions, and in line with the WHO treat and test and treat all strategy, advising to start the treatment regardless of the disease stage, again with a high priority to the key populations. Strategic Direction 3 responds to the need for an enabling social, legal, and policy environment in order to optimize the service delivery. It identifies the best approaches for delivering services by promoting integrated, people-centered services, ensuring equity and quality. And this is a work we already initiated with the Department of Health Systems and Public Health in the region, providing support to the countries in designing and transforming their health systems. Of course, it engages the civil society and including people living with HIV in the design and delivery of the interventions. Strategic Direction 4 urges member states to develop sustainable and innovative models to finance, to ensure that the sustainability of financing of their HIV response is assured. And as we see more and more countries in the region facing either cost constraints or many going through the transition phase from the external funding support, this is becoming an important area. So as a result, we are happy and ready to work together with the countries to advocate for increased domestic resources, all to take actions to reduce the costs by using efficiency-focused strategies, including strengthening procurement and supply management systems. In that aspect, we will continue to work with the partners and promote the strategic partnerships to be able to support the countries in need. And finally, Strategic Direction 1 is innovation for acceleration, which is looking into the major knowledge and major gaps in knowledge and technologies, highlighting the innovation which is required to shift the course of the HIV epidemic. Particularly, I will mention some new advancements like the pre-exposure prophylaxis or innovations in communication, which addresses some behavior change and also strategies for engaging key populations. In front of you, there's a draft resolution, which I'm not going to get into the details, defining the actions and the commitment requested by member states, as well as the commitment of the Secretariat. And we look forward to your comments on both to the action plan and the resolution. We hope with your support, this action plan will call for an urgent and accelerated health sector response to HIV to end the AIDS epidemic as a public health threat in the region. Thank you very much.
Thank you very much, Dr. Emiroglu. Let me now ask Dr. Salomuddin Yusufi, SCRC member from Tajikistan, to give the views of the Standing Committee. Dr. Yusufi, you have the floor.
Director General, Regional Director, Ministers, ladies and gentlemen. On behalf of the 23rd Standing Committee of the Regional Committee, I am pleased to welcome the action plan for the health sector response to HIV in the WHO European region. I acknowledge that the feedback has been taken and advice from our previous sessions has been well considered in the current version presented to this session of the Regional Committee. I'm also pleased to recognize that the development of the action plan was a transparent and inclusive process that gathered feedback from member states, relevant United Nations agencies and programs, international organizations, other major partners, professional networks, and civil society organizations throughout the region. This region-wide participatory process was also supported by an advisory committee established to assure an accurate technical review. This process has clearly ensured that the regional context is well articulated and that the plan takes into account the diversity of health systems, HIV epidemiology, available resources, and national contexts across the region. We further note that this action plan builds on the momentum generated by the work of the previous European Action Plan for HIV/AIDS 2012-2015 and derives from the Global Health Sector Strategy on HIV/AIDS endorsed by the 66th World Health Assembly in May of this year. These ambitious yet achievable goals and targets in the action plan, notably the 90-90-90 targets for testing and treatment, will help countries achieve their commitments. The 2030 Agenda for Sustainable Development and the Sustainable Development Goals, the multisectoral UN AIDS Strategy 2016-2021, the Global Health Sector Strategy on HIV for 2016-2021, and Health 2020, the European Policy for Health and Well-being. The new action plan provides guidance and tools to put a greater emphasis on urgent and accelerated actions at the country level to turn back the epidemic in this new fast-track phase of the response. It asks that member states define and deliver an essential package of services relevant and appropriate to their epidemics and national contexts. And here, they have to focus on key populations and addressing social inequalities. We accept that the region is at a critical point with regards to HIV and that member states need a renewed and reinvigorated political commitment in order to ensure sustainable financing to implement evidence-based policies and technical and programmatic innovations. I would like to recommend kindly on behalf of the 23rd Standing Committee of the Regional Committee the present action plan for adopting by this regional committee through endorsement of the related resolution. Thank you for your attention.
Thank you very much. I now open the floor for discussion and ask delegates wishing to speak on the issues raised under this item, please to raise their nameplates. The Netherlands.
Thank you, Chair. The Netherlands is very pleased with the action plan for the health sector response to HIV in the WHO European region. The increasing number of HIV infections, but also the rise of tuberculosis and viral hepatitis in the European region is a serious concern. Political leadership and investments are essential in order to achieve the international objectives set by the high-level meeting on HIV/AIDS, June of this year, as well as the 90-90-90 targets of UNAIDS. Of course, national authorities are first and foremost responsible for their AIDS, TB and malaria responses. However, in view of the mobility and migration in the region, the interaction between countries and regions within the European region and the cross-border nature of infectious diseases, countries cannot do this alone. The problem has become too huge to be tackled effectively and efficiently by individual member states alone. The Netherlands is in favor of more international cooperation in the WHO European region and would like to call upon member states to join forces to implement a multidisciplinary and inclusive approach to tackle these diseases. For instance, it would be very useful if the member states would jointly work on strengthening surveillance and monitoring. The Netherlands would welcome to share experiences and knowledge on HIV monitoring and learn from other member states, for example, how to monitor the spread of hepatitis. Another topic for cross-fertilization is how to involve people living with HIV and key populations like sex workers, men having sex with men, and drug users in a meaningful way to strengthen human rights and evidence-based responses to the three diseases, and how to build relations with groups most at risk, so that they are not anymore regarded as part of the problem, but as part of the solution. In 2 years' time, Amsterdam will host the next International AIDS Conference in July 2018. It would be great if this region could present its joint efforts, as well as the progress achieved of fighting back the three diseases, HIV, TB and viral hepatitis. Thank you.
Thank you, the Netherlands, and I give the floor to Azerbaijan, followed by the Russian Federation.
Уважаемая госпожа генеральный директор, уважаемая госпожа региональный директор,
The Director General, Regional Director, ladies and gentlemen, we are part of the country with a low level of HIV, but given the transboundary nature of this infection, the problem remains relevant for us too. In 2006, the Global Fund started an antiviral therapy, which at the present time is taken on by the government. We have developed a program on bringing down the infection of HIV, removing discrimination and encouraging preventive measures. We have also taken on this program, and the ministers also have endorsed a program to control HIV for the years 2016-2020. Within the framework of this program, we are carrying out diagnosis treatment as well as treatment with appropriate medical products. In 2010, we have adopted a law on HIV control, which takes on board all the recommendations of the WHO and other UN agencies. Given the Sustainable Development Goals by the year 2030, and given the importance of HIV control and the European policy of HIV control and Health 2020, we therefore support the plan of action on HIV control in the European region. Thank you very much.
Thank you very much, Russian Federation, and I give the floor. No, it was Azerbaijan. Sorry. Thank you, Azerbaijan, and I give the floor to the Russian Federation, followed by Germany.
Director General, Regional Director, Chair, distinguished colleagues, the Russian Federation would like to thank the Secretariat of the WHO European Office for the work done in preparing the draft action plan for the health sector response to HIV in the WHO European region and the corresponding resolution. This is a very topical issue, particularly for the Russian Federation. In our country, we have experts and public organizations very much involved in the ongoing work in this area. Indeed, the Health Ministry has developed a special state strategy for the period up to 2020 and beyond. That strategy sets down the key principles and directions for state policy within our country in this area, and it is all based on an intersectoral approach. We have prepared a draft plan to implement that strategy, and it is intended that that should be adopted this year, 2016. In preparing the relevant documents, we took as the basis for our work the WHO strategy and plans, as well as international programs focusing on HIV control. The key priorities for the strategy and the plan, then, are measures on primary prevention, work on prophylaxis, and also accompanying those living with HIV infections, with a particular focus on key populations and involving relevant NGOs. We seek also to expand the coverage of testing within our population and to make ART more widely available. We've already achieved a great deal. In Russia, every year, free of charge, more than 20% of the population can undergo HIV testing. We also have a whole set of effective preventive measures in Russia that have been implemented for the past 10 years, and this has made us one of the leading countries in halting vertical transmission and indeed in 2015, the risk of MTCT was only 2%, and we would like to become one of those countries that have fully eliminated that form of HIV transmission. It's important to emphasize that in implementing these measures, funding comes out of the state budget, and those who are suffering from HIV infections are freed from any financial burden. Nonetheless, there are still serious challenges that have to be faced, and we have to ensure that we can really abide by the key principles of making treatment available to all, also update national guiding principles on treatment and care of those living with HIV, and we also need to focus particularly on co-infections and comorbidities, which in themselves can be a cause of the worsening of the condition and even the death of people living with HIV. I'm thinking about things like STIs, tuberculosis, hepatitis C, and drug dependency. All of these measures are related not only to professional and organizational aspects of the work, they are also state priorities for us, and they are areas that are dealt with within the financial and economic resources of the state. Overall, then, we have these key goals, and that being so, we would like now to suggest in the penultimate paragraph of the draft resolution, this is page 3 in English, the following words. We are proposing this addition then, the words adapted to national priorities, legislation and specific contexts. This formulation was already agreed by countries at the 69th WHA in May this year. And indeed, we also saw that a resolution was adopted on 3 strategies, that is to say HIV, hepatitis and STIs. The wording was thereby agreed upon. We would therefore invite countries to support our proposal, and we certainly very much hope for further improvement and development in this area, in the international community and in the work that we do. We therefore support the resolution with the addition proposed by the Russian Federation. Thank you for your attention.
Thank you very much, Russian Federation, and I give the floor to Germany, followed by Italy.
Danke, Frau Vorsitzende, sehr geehrte Damen und Herren. Die Beendigung von AIDS bis 2030 ist eine große Vision und Versprechen an alle Menschen, die mit HIV leben. Ein koordiniertes Vorgehen ist notwendig, um HIV langfristig.
We think that we need to work together.
Evidenzbasierte, integrierte und abgestimmte Ansätze sind dafür erforderlich.
We need to have approaches that are founded on scientific facts, and therefore we welcome the plan of action. And in particular, for the countries of our region, there are people who are directly affected by HIV as a result of their sexual preferences or because of their drug habits. They're stigmatized. They're particularly stigmatized. And so we need to take that into account. We can achieve our objectives. We realize that drug taking is a disease, and if the appropriate measures are taken, HIV cannot be seen just on its own. We adopted our strategy in 2016 in Germany, an integrated, comprehensive strategy to take into account all types of sexually transmitted infections, including HIV. Given that the transmission paths are the same, the risks are the same, we see a great many common denominators here, and that also can be extended to the way that we treat our patients. In order to reach the greatest number of people, we need to make available medical care, take into account the age of the people most affected, and therefore we will improve the treatment that we give such people, and it will also help to prevent such transmission. We need to have these kind of agreements in order to be able to guarantee tests and treatment. So in Germany, we have new approaches when it comes to treatment, and the behavior of doctors and other actors are brought in to collaborate more and more. Another condition for success is better communication between partners, between the doctors and the patient, and Germany has taken on this responsibility as well as other partners when it comes to HIV control. And we think that the plan will help us achieve our objectives, and that we have a common responsibility to carry out these targets and to achieve this. Thank you.
Thank you, Germany, and I give the floor to Italy, followed by Latvia.
Thank you, Chair. Italy endorses the plan and resolution. We would like to see key population explicitly indicated, though, such as MSMs, migrants, drug abusers, sex workers, prisoners, transgenders, as well as people living with HIV as partners, and people living with co-infections, also in the resolution. The plan reflects gender equity and gender sensitive approaches and activities and should be carefully mirrored by national plans. We are also very much in favor of advocating strongly for innovative testing, as well as for the adoption of pre-exposure prophylaxis. We remind also the need for treatment adherence strategies targeting chronic HIV patients being strongly addressed and adopted. Italy has anticipated the resolution's main issues in its current national HIV plan update. The new plan is in an advanced drafting format and has received coherent contributions from civil society, patient associations, key populations representatives and activists, with the support and technical and scientific assistance from national institutes, scientific societies and the regulatory agency. Not an easy job indeed. Italy thinks the plan and resolution will be crucial tools to make sure we achieve the ambitious objectives set forth and recommend strongly to look at cross-border collaboration in favor of mobile populations such as sex workers and migrants as possible preferential vehicle and victims mainly of the infection and of discrimination and exclusion. Thank you.
Thank you, Italy, and I give the floor to Latvia, followed by Malta.
Latvia welcomes the action plan for the health sector response to HIV in the European region and supports the resolution. Latvia is still one of those EU countries that have high HIV prevalence rates. Reduction of HIV transmission, including vertical transmission, is one of Latvia's priority. We thank the WHO European Office for the assistance provided to Latvia over many years, including during the recent country mission on elimination of HIV mother-to-child transmission. And we commit the Ministry of Health to taking forward the recommendations. We look forward to working with WHO and other partners to implement the action plan and to urgently accelerate a fast-track response to HIV. We are committed to the goal of ending the AIDS epidemic as a public health threat by 2030. Thank you.
Thank you, Latvia. And I give the floor to Malta, followed by Austria.
Thank you, Madam Chair. I would like to thank and congratulate the Secretariat for the action plan presented to us and document R66-9. The burden of from HIV is increasing with the number of new cases on the increase and changing characteristics in risk group transmission categories over the past years. Malta is currently having the highest rates of new infections since the start of the epidemic, with changing characteristics whereby MSM is the most commonly affected risk group. A multi-stakeholder think tank was set up last year to develop actions specifically targeting this HIV challenge. A prioritization exercise carried out recently has identified HIV as a priority infectious disease in Malta. There is agreement that we need a comprehensive and unified effort towards tackling HIV. An HIV strategy has been drafted and is currently in the process of consultation. The strategy provides an evidence-based, action-oriented approach to address HIV/AIDS situation in Malta, focusing on governance, prevention, testing, treatment and care, creating an enabling environment and surveillance, monitoring, evaluation and research. We must ensure that the range of social, structural, financial, legal and individual barriers which are impacting on prevention, testing, treatment, care and support required are also addressed. During the Malta presidency of the Council of the European Union in the first half of next year, Malta will be hosting a technical meeting on HIV in collaboration with the European Centre for Disease Prevention and Control. The overall aim of this technical meeting is to bring together leading experts on HIV prevention and control from across Europe to discuss how Europe can achieve the goals outlined in the Sustainable Development Goals, those adopted in the Global Health Sector Strategy at the World Health Assembly, actions agreed at the UN General Assembly, and of course this Action Plan for Europe. The experts will discuss evidence-based strategies, share achievements and examples of good practices, identify solutions to common challenges, and define priority areas where the Member States can scale up their efforts. The outcomes of the meeting will be outlined in a technical declaration of commitment. We believe that a high-level political commitment to fast-track actions on HIV and AIDS is essential, and to support this, our Minister will be discussing the issue with other European Union health ministers in the ministerial meeting in Malta in March next year. Malta is committed to tackle the emerging problems of HIV/AIDS and will be at the forefront to ensure HIV is high on the political agenda of Europe. Malta welcomes the action plan for a health sector response to HIV in the European region presented in R66/9 and strongly supports its adoption. Thank you.
Thank you, Malta, and I give the floor to Austria, followed by Armenia.
Danke, Frau Vorsitzende.
Thank you, Chair. Ladies and gentlemen, Austria would like to express support for the draft resolution and also for the action plan. Microphone for the speaker, please. Austria then supports the resolution, the action plan, and WHO's objectives in seeking to fight against HIV/AIDS. We believe that information is crucial. It's only by increasing knowledge, by making people better informed, and by sharing data among ourselves that we can ensure that we take the right decisions. Preventive measures and treatment measures that are based on evidence can be more easily targeted, and we can therefore get to the greatest number of people who really need help. In Austria, we have seen an epidemiological development of HIV/AIDS, and we have considered the idea of ensuring that people who are infected have an obligation to inform of that. When it comes to prevention and information, we know that there is still a long way to go, and our health ministry is working closely with civil society in trying to implement the targets that we have, and we do want to get through to the most vulnerable groups. Thank you.
Thank you, Austria, and I give the floor to Armenia, followed by Switzerland.
Thank you, Chair, distinguished members of this committee. Armenia has been particularly active in the work that was undertaken in developing this action plan, and that happened throughout the elaboration of the plan. The plan itself is intended to be rolled out within the WHO European region, but it represents part of a bigger WHO strategy to combat HIV/AIDS throughout the world. And we know that we have set ourselves ambitious goals in seeking to halt the spread of HIV/AIDS by 2030. This again is very much in line with the goals that were established by the UNGA when deciding upon the Sustainable Development Agenda. Armenia itself has done a great deal in seeking to counter HIV/AIDS, and our country was the first in the European region that was able to achieve a certificate saying that mother-to-child transmission of AIDS had been eliminated. As I said, we have ambitious goals at European level and also certainly within Armenia. We know that the Sustainable Development Goals are very ambitious, and we also know that looking at the post-2015 agenda and the 2030 agenda, it's clear that we need to develop innovative approaches that are based on evidence and scientific means of combating AIDS. And this is very important. It's not important not just to accelerate the way in which people roll out the measures that have been decided upon, upon. It's also important that we increase the resources available, that we enhance investment in this area in order to make it possible for us to combat HIV/AIDS across the board. We recognize also that there's a linkage between HIV/AIDS and other very important phenomena such as migration. Certainly within our region, that is something that is very important. And if you look at the European region, in 2015, most of those who were infected with HIV were migrants. And that being so, we have to focus particularly on how we can combat HIV/AIDS among migrants, including labour migrants. And we have to make sure that appropriate healthcare services are available to people who need help. And if we do not do that, it will be very difficult for us to achieve the goals that have been set. As well as that, we need to look at some of the wording in this resolution and ensure it's fully in line with what has already been agreed upon in terms of prophylaxis and preventive approaches. We know that we need a holistic approach to this, in which we recognize that there are challenges that have to be faced both in pre-exposure prophylaxis and also in treatment. Overall, however, we support this draft resolution. Thank you for your attention.
Thank you, Armenia. And I now give the floor to Switzerland, followed by Spain.
Merci, Madame la Présidente.
Thank you, Madam Chair. Switzerland fully supports the strategic orientation of the action plan for the health sector response to HIV in the WHO European region. We are concerned about increase in infection rates, and we are also very concerned about the fact that this seems to be concentrated in certain key populations in Eastern Europe and Central Asia. Certainly, in the past year, a great deal has been done on this issue. I would note in particular the high-level meeting on ending AIDS in New York. Switzerland wishes to support the strategic approach that has been outlined here with a focus on target groups and most vulnerable groups. And we certainly wish WHO every success in the work that is being done. We ourselves are very committed, particularly to working with prisoners and with those who are injecting drug users. Our approach in Switzerland is really based on risk prevention, and we also think that it is essential to focus on those who are primarily concerned by HIV/AIDS when we try to find solutions to this problem. I'd like to make a few comments on the action plan itself. When thinking about the exchange of data on migrants, which is referred to in paragraph 27, we think that this should indeed be automatic. We also think that rules of confidentiality and patient confidentiality should still apply, as they would to any kind of doctor-patient relationship. We support the proposal of having a set of key interventions to combat HIV/AIDS, as described in paragraph 30. We would like to know whether WHO Euro intends to continue its commitment to promoting health of prisoners and detainees, because we think this is another very important area. We would call upon the regional director to implement this approach in tandem with the overall WHO strategy in this area. We certainly believe that if we have the full involvement of civil society, a key player in this area, we can have made great strides by 2030 in accordance with the provisions of the 2030 agenda. We support then the draft resolution. Thank you.
Thank you, Switzerland. And I give the floor to Spain, followed by Estonia.
Madam Chair, Madam Director General, Madam Regional Director, Spain's strategies for prevention and control of HIV have always been in harmony with those of the WHO, UNAIDS, and the EU Directorate General for Communication and their respective action plans. Notably, in Spain, antiretroviral treatments are free of charge, and mechanisms have been implemented to provide the entire population with access, irrespective of their administrative status. The strategies applied to date have helped to foster early diagnosis, reduce mortality among adults, and improve maternal and infant health. As a result, mother-to-child transmission has been virtually eliminated among babies born in Spain. HIV screening during pregnancy was introduced in the early 90s, along with natural conception programs to improve sexual and reproductive health for serodiscordant couples in which the index case is receiving antiretroviral therapy with undetectable viral loads. Our political response is focused on bolstering, bringing together and harmonizing the sector activities of government administrations and organizations and non-governmental organizations. These activities are coordinated to stop the spread of HIV infections and oversee the quality of healthcare and social services for affected people. All of this is carried out while seeking synergies with other health campaigns. Spain therefore supports the approval of the 2016-2021 Action Plan for the health sector response to HIV submitted at the 66th session of the WHO Regional Committee, agrees with the principles contained therein, and will contribute to achieving its goals and targets. Spain will also continue to contribute to improving insight into the characteristics of the epidemic by participating in evaluating and monitoring, and proposes that this is done every 2 years to enable coordination of all the agencies' responses to the epidemic. Thank you very much.
Thank you, Spain, and I now give the floor to Estonia, followed by France.
Thank you, Madam Chair. I will be brief. Estonia thanks the Regional Office for their hard work on the action plan. Many important points have already been made by previous speakers. We support the statements made by Germany, Italy, and the Netherlands. This epidemic cannot be stopped in the region without all governments being committed to improve testing, harm reduction services, access to healthcare and social services. That is the full package of evidence-based interventions. We call on WHO to provide assistance to member states in this regard, to allow all patients to receive the care they need. Madam Chair, Estonia supports the action plan and the adoption of the resolution. Thank you.
Thank you, Estonia, and I now give the floor to France, followed by Kyrgyzstan.
Merci, Madame le Président.
Thank you, Madam Chair. France welcomes this action plan for the health sector response to HIV, and France will contribute to its attainment. We note that this plan will help us in achieving the SDGs, which has set 2030 as a goal for eliminating HIV/AIDS. Globally, the past 15 years have represented progress. Coverage of treatment for many infections has been extended, and we've also seen new therapeutic possibilities available, including ways of treating comorbidities such as hepatitis A, C, or tuberculosis with HIV/AIDS. And in fact, the next few years are going to be decisive if we're going to win the fight by 2030. And really, the European region can make the difference. As has repeatedly been said, between 2005 and 2014, we saw an increase of 76% in terms of new infections in the European region. We now then need to step up a gear in our fight against HIV/AIDS. The question of financial sustainability. This is one of the key principles underpinning this action plan, and it is crucial. If we're going to have financial commitment, we need also to have a collective commitment to establish a community centre which involves civil society as a full-fledged partner and player. Fighting against HIV/AIDS has to remain in the avant-garde of our fight to promote human rights and respect for all people. There's still a long way to go. The most vulnerable in particular continue to fall victim to discrimination and continue to be stigmatized. And these things prevent them getting access to care and to the preventive treatment that they need also. Today, then, we need to go on doing what we're doing, but we also need to do more, and we need to be innovative, and that includes financially. We also need to be innovative in terms of the way that we approach research. In France, we try to have innovation, something made available to all. People who do not have access to classic types or conventional types of treatment are often the most vulnerable people. We need now to find innovative ways of getting through to everybody. As of 2010, we've had a rapid diagnosis testing system, and we also have a self-testing system that has been in existence since last year in our country, and that has helped to reduce the extent of this hidden epidemic in France. What about pre-exposure prophylaxis? This is also very important, and the French Health Ministry has decided to authorize access to PrEP, P-R-E-P. That happened in November last year, and this is a decisive step forward in our attempts to combat HIV/AIDS, and it shows how authorities, research bodies and civil society can fruitfully cooperate for the benefit of all. Thank you.
Thank you, Franz. And I now give the floor to Kyrgyzstan, the last member state on my list.
Thank you, Madam Chair. Director General, Regional Director, ladies and gentlemen. Seeking to curb the spread of HIV/AIDS is one of the priorities for Kyrgyzstan. Certainly, it's particularly important to us in the field of public health. We have a national policy on combating HIV/AIDS, and it's based on a multi-sectoral approach, and it involves state authorities, NGOs, and also the donor community. We have worked within the Kyrgyz Republic in accordance with international recommendations on HIV control. Every 5 years, we develop a state program which is based on an intersectoral approach, as I've said, and which also takes due account of the epidemiological situation in the country, as well as recommendations made by UNAIDS and by WHO. We are seeking then to improve management of our system and to optimize all of the work that we do in seeking to combat HIV, tuberculosis and malaria. And indeed, we have a coordination committee in the country that seeks to ensure that all we do is properly coordinated. We also work with drug users, and this is particularly important, and we have methadone replacement therapy that is made available to those who are drug users and who need such therapies. We have the NGOs sector very much involved in our preventive efforts to get through to key populations, those who are at high risk of HIV infections. They are able to provide many different types of services to those people, and they're able to do a great deal in seeking to make them less exposed to the danger of acquiring HIV/AIDS status. All that we do in Kyrgyzstan is possible thanks to the fact that we have donor-funded programs, that we also receive considerable assistance from WHO and, as I say, from donors. And this is something that we find very useful indeed in supplementing our own efforts. We know that funding for our program is very important because our state budget is able to make a contribution, but it's not able to fund all of the programs that we seek to roll out, given the economic and financial crisis that we face at present. We need technical and financial assistance. We fully support the action plan and the draft resolution that will be adopted here this afternoon at this session. Thank you very much for your attention.
Thank you very much, Kyrgyzstan. And I now give the floor to Dr. Kanto, a representative of the Global Fund to Fight AIDS, Tuberculosis and Malaria.
Thank you, Madam Chair. Dear ladies and gentlemen, the Global Fund Secretary would like to commend the WHO Euro Office for its leadership in developing with partners this action plan. The Global Fund will provide resources to contribute to the implementation of the plan in countries meeting the eligibility criteria determined by a country's income level and official disease burden data. We fully share the concern about the continuing public health threat that HIV poses in the eastern part of the region and the high proportion of people living with HIV who are unaware of their HIV status, are diagnosed at a late stage of infection and do not receive any treatment, care and support. In particular, the Global Fund is also concerned that the current scope and scale of action is insufficient to reverse both the HIV and the tuberculosis epidemic in the region, and that the acceleration of the response with a focus on evidence-based high-impact interventions such as harm reduction for people who inject drugs by all member states is urgently needed on a broader scale in order to meet the regional and global targets. While in Eastern Europe and Central Asia, the epidemics remain by and large concentrated among key affected populations, such as people who inject drugs, men who have sex with men, sex workers, and prisoners. In a couple of countries representing the highest burden of HIV in the region, the epidemic is now spreading among the general population, causing avoidable and unacceptable suffering and tragedy among young population who are hiding their HIV status because of the deeply rooted stigma and discrimination in the society and policy makers. A sustainable response will only be achieved when the epidemic is under control and no longer expanding. In this respect, we also urge countries of Eastern Europe and Central Asia to reinforce their political commitment by ensuring targeted counterpart financing and enabling a regulatory framework for the endorsement of evidence-based and cost-effective policy as a matter of public health and human rights. On the eve of the 5th Global Fund replenishment hosted by Canada this week, we would like to express our deepest gratitude to the donors and implementing countries of the WHO Euro region, to WHO and all partners for our resilient and effective partnership to jointly fight HIV, tuberculosis, and malaria. Thank you very much.
Thank you very much. And I would now like to give the floor to Ms. Alana Armitage, Regional Director of UNFPA.
Thank you very much, Madam Chair. Excellencies, Director General, Regional Director, ladies and gentlemen. It's a great pleasure for me to deliver the following statement by the UNAIDS Regional Director for Eastern Europe and Central Asia, Mr. Vinay Saldana. Mr. President, dear delegates, on behalf of the joint United Nations Program on HIV/AIDS, UNAIDS, Regional Support Team, we are pleased to express our strongest support for the new WHO Action Plan for HIV in the European region. In her opening address, the Regional Director highlighted HIV as one of the few areas where the Euro region is failing. However, getting on the fast track to end AIDS isn't complicated or even difficult, but it will require urgent and bold steps beyond business as usual. This action plan is exactly the kind of game plan that all countries need to implement in their health sector. It shows that the health sector has a lead and unique role to prevent, diagnose, and treat HIV infection. Some may consider that the targets in this action plan are too ambitious. However, UNAIDS calls on member states to be consistent. This action plan maintains the same level of ambition that you committed to at the UNGA high-level meeting in June. This action plan translates these commitments into practical steps that every country should implement to get on the fast track. If you are ready to adopt this action plan today, you have the full commitment of UNAIDS and our co-sponsor agencies that we will work with you, member states, to put this action plan into practice at the country level. Let's make AIDS history. I thank you very much.
Thank you very much. And I would now like to give the floor to Professor Kazachkine, UN Secretary General, Special Envoy of AIDS for Central Europe and Central Asia.
Thank you, Madam Chair, Madam Director General. I would like to start by warmly thanking the Regional Office for framing and drafting what I consider a relevant, comprehensive, and strong action plan for the health sector response to HIV in the region. I would also wish to thank you, Madam Regional Director, for your leadership and your call on day one of this meeting for member states to urgently address the AIDS crisis in Europe. The plan of action that is submitted for approval is fully in line with the approved WHO Global Health Sector Strategy on HIV, with the UNAIDS strategy, as we just heard, and with the ultimate objectives of the political declaration adopted at the high-level meeting on AIDS in June this year in New York. We rightly celebrate successes in the region in decreasing and eliminating vertical transmission of HIV. But this cannot and should not take our attention away from the fact that in Europe, and primarily in eastern part of the continent, primarily the eastern part of the continent remains the only region of the world where the HIV epidemic continues to grow. In Eastern Europe and Central Asia, the number of newly HIV cases has increased by 57% in the last 5 years, while incidence and AIDS-related mortality have decreased by 30 to 40% globally in the last 10 years. HIV, in addition, is inextricably linked with TB, MDR-TB, and hepatitis C in the region. And as delegates would know, the wide extent of drug resistance in Eastern Europe represents a critical challenge to TB control. Dear colleague delegates, it is essential that we fully recognize that HIV continues to be an ongoing epidemic health emergency in the region. The European Plan of Action that is submitted to you is a robust plan that complements the TB Plan of Action for 2016-2020 approved last year. I urge you to approve it. As the Secretary General's Special Envoy, I urge you to intensify access to effective prevention and treatment for the many people in need in the region, with a strong focus on vulnerable populations, to remain committed and refuse complacency. I urge the regional office to further strengthen its capacity for HIV and TB at country and regional levels. Europe cannot persist in being the epidemic exception in the global fight against HIV/AIDS. Thank you.
Thank you very much, and we will now move to NGOs. The World Federation of Occupational Therapists has submitted a written statement. This can be found on the website. And I now call on the representative of AIDS Healthcare Foundation Europe to deliver his statement.
Madam Chair, thank you for the opportunity to speak on behalf of AIDS Healthcare Foundation Europe. We are deeply concerned with the current state of HIV epidemic in WHO Europe region. Though there are advancements in novel HIV therapies and care delivery for people who live with HIV, and there is an understanding that every person who lives with HIV should be diagnosed and have access to HIV treatment and care, this is far from the reality in the WHO Europe region. Eastern Europe sees a continuous increase of HIV cases. It is also true for Western Europe, where infections are rising among men who have sex with men. Undiagnosed HIV is a major problem. Many people living with HIV are suffering from co-infections with tuberculosis and viral hepatitis, which makes the disease more deadly and increases the burden on the health system greatly. People from key affected populations, people who use drugs, prisoners, men who have sex with men, sex workers, transgender people, migrants, street children are disproportionately affected by both the burden of the disease and low treatment coverage. Clearly, business is not finished and bold actions are needed. We welcome the action plan for the health sector response to HIV in the WHO European region. We align with the strategic directions described in the plan. The action plan sets ambitious targets, but after 30 years of HIV epidemic and limited impact in parts of the region, we need to be daring and courageous. There are regions that have much less resources and are more advanced in fight of HIV than Europe. To turn the tide of HIV epidemic in Africa, it was possible by the unified efforts of world political leaders, African heads of the governments, and communities affected by HIV. We call on the Europe political leaders to unanimously recognize the goal for 2030 to end HIV epidemic as a public health threat in Europe as part of their political agenda. To achieve the goal, we need to keep the promise to end AIDS, work tirelessly to reduce new infections using proven prevention interventions, dramatically increase targeted HIV testing and linkage to care, increase HIV treatment coverage, and reduce deaths related to AIDS and TB, deaths which are preventable now in the 21st century. This can only be done by strong political and financial commitment from the member states. We need to change the way we think about HIV as a disease and people who live with HIV. HIV is a chronic disease, not a condition that people need to die from. People who live with HIV are valuable citizens of European society. We recognize WHO work on current priorities for health system strengthening, people-centered approach, health system reform, and related to it task shifting as effective to address HIV as a chronic disease. HIV Europe is committed to work together with the member states and all stakeholders to make Europe free from HIV by 2030 and support each and every person living with HIV. Thank you very much.
Thank you very much, and I would like to remind NGOs to stick to the 3 minutes. Thank you very much, and I would now like to give the floor to Dr. Emmy Roblum to respond to the comments and questions raised.
Thank you very much. First of all, I'd really like to thank the member states for your commitment and your broad support, and as well as the Global Fund, the UNAIDS, and the NGOs who has been really calling for bold actions. Yes, it's time for the accelerated action and investment, and as the regional office, we are committed to continue to support the member states. In that aspect, I think increasing the political commitment is critical. I would like to thank Netherlands for hosting the conference, as well as Malta taking it as one of the EU presidency priorities. I have heard the same messages over and over again. We have to intensify access to prevention, diagnosis, treatment, and care, with a special focus to key population, which is in the essence of the action plan, actually. And then avoiding the stigmatization and discrimination. And I also note the specific comments related to migrants and prisoners, which is included in the action plan. Thanks to Netherlands for offering the support in prioritizing surveillance, as well as the experience in engaging the civil society and people living with HIV. This is something we would like to continue to learn. And also, we noted your request for the regional office to take a more active role in addressing the collaboration issues, particularly cross-border collaboration, and also linked with the migrant and refugee health, which is in the strategy that you have already endorsed, and an area we are working together. So we also noted the Russian Federation amendment to the resolution, which will be taken later on, and also the comments from Switzerland on the data exchange and migrants. Thank you very much. We are looking forward to a continued collaboration and your support to be able to change the epidemic in the region. Thank you.
Thank you very much. And would you like to take the floor? Yes, DG, you have the floor.
Thank you, Madam Chair, Madam President. Thank you. Congratulations for taking on this very important position. I was listening very carefully, and I'd like to thank honourable ministers and delegates for their rich intervention, as well as NGO, and of course, my old friend and good friend, Michelle. As I said this morning, this region is a very important region in WHO, and you have so many achievements. But I also said in my address, one of the challenges for this region is to address the rise in HIV, while all other regions in WHO are improving, and this is the only region that is increasing. So I want to reinforce the importance of paying political attention, investing resources, and you can do it. I'm very confident because you have done it on so many other issues. I just want to reflect on thanking the Netherlands and Malta for your follow-up actions, but also don't forget the 5th Global Fund replenishment is in Canada this weekend, on the 16th or 17th in Ottawa, no, in Quebec. So I know that many countries in this region have been major donors for the Global Fund replenishment, and we thank you for that generosity. I also would like to pick on one point. Of course, all the interventions are important. One point made by France. You highlight the importance of early diagnosis and early treatment. And WHO, some years ago, have actually came out in a strong way to say that early treatment is actually prevention. And I want to emphasize that important point. And this is an area that we need to pay attention to. Thank you.
Thank you, Director General. We can now consider the adoption of the draft resolution with the proposed amendments contained in the document EUR/RC66/ConfDoc5 revision 2, and this revision 2 already includes the amendment from Russia. Is the committee willing to adopt the proposed draft resolution by consensus? I see no objection, so the resolution is therefore adopted.